I'm Carolyn Morgan, host of This Medical Moment. Join me as we hear from entrepreneurs who are changing the standard of care. This Work Break series will take less than 10 minutes of your time, and I promise you'll learn more about the future of healthcare. Kevin, I'm pleased to welcome you to This Medical Moment. Thank you so much for joining us. So what made you want to join Exact? What was that initial contact and how did that all come about?
I received a telephone call from the board of directors of Exact Sciences. They had twice tried to develop a stool-based test for screening for colon cancer, but there was no product, there was no technology, and there was no proof that scientifically this was possible to actually detect colon cancer accurately from a stool sample. And the board said, hey, before you say no, would you go to the Mayo Clinic and sit down with Dr. David Ahlquist, who's working on solving this problem? And Dave presented this incredibly rich evidence showing the possibility of developing what became Cologuard. And left that meeting and knew that this was really what I was meant to do.
It's fascinating, the entire story, and it's a rags to riches. And you probably didn't realize how successful the product was going to be at that time. What makes Cologuard so novel?
Cologuard is designed to address a gap. And in this case, it's a massive gap in colon cancer screening. So colon cancer is the #2 cancer killer. 110 million Americans are supposed to be screened every year for colon cancer. Today, 45 million Americans who should be screened are not screened. And we wanted to develop a great test, really accurate, incredibly user-friendly, and a test that ultimately could be used by all 110 million Americans, that we can ultimately eradicate this disease.
So take us on that journey. What were the challenges that you and the team faced as you were bringing this product to market?
The first thing that we faced was, how in the heck do you make this test work? And that's when we hired our chief science officer, Graham Lidgard. And when he joined us, I remember he went into his office. He had this big stack of papers. And then 2 weeks later, he came out of the office and he said, I have it. We are going to have a test that combines DNA methylation markers, DNA mutation markers, and a protein marker. And we left that meeting and said, let's operationalize it and let's do this the right way. And that was the overriding principle, was we're cutting no corners. We're going to do everything the right way and make this a test that we could really be proud of. And it was from that point in time till 4 years later that Cologuard was born.
I saw that you recently said that about 50% of all primary care doctors have ordered at least one Cologuard test, which is just phenomenal. What's been critical to that success story?
One of the big challenges was getting commercial insurance companies to pay for the test. Another thing, as you know, Carolyn, was how do you educate the world about Cologuard? And PRECISIONeffect played an incredibly important role of bringing our baby to people and physicians. And over a 10-week period of time in the markets that we ran that television commercial in, we saw a doubling of the number of Cologuard tests. And then we were off to the races.
The biggest thing I think that we really experienced when we were working with you on this was the need to change behavior, not only for patients, but also for the physicians. What do you think was really critical, getting physicians over the hump of really accepting Cologuard as a critical tool in their tool belt?
Well, it's a couple of things. Number one, evidence and guideline inclusion is critical. And you can't do that with one study. It needs to be multiple studies and kind of this wave of evidence. And then the information flow all the way from patient intake, and the test order, all the way to completion of the test and the test results are now are seamless electronically for many physicians. So there has been a huge investment in IT connectivity with physicians across the country.
We've gone through the story of launch. Where's the product at now?
Well, I'm happy to report that we're approaching 5 million people who have been screened with Cologuard. It's an incredible success story.
We find ourselves in amidst a pandemic, something that we've never experienced in our lifetimes. How has that impacted your business this year?
So it was March 14th that I had a call with the senior people at the state of Wisconsin, the Secretary of Human Health, and they reached out about whether we could help them bring up testing in the state. And it was just a few weeks later that Exact Sciences had an emergency FDA approval, and we converted a significant amount of our lab capacity to COVID testing. And so we have been able to test a significant percentage of the testing in our home state of Wisconsin, but also people in all 50 states.
Can you tell us a little bit about sharing with other entrepreneurs, which I'm sure you get asked to do all the time, Kevin? I mean, you're somebody that so many people look up to. What kind of advice do you give them when they're getting started and they're looking at, bringing something novel into the medical world?
Don't be afraid to run the experiment that tells you whether your product is as good as you think it is. Go do that. And the only way to do that is to go run the big study. That's one. The other thing I always try to impress upon entrepreneurs in this field is, in addition, just do things the right way and never cut corners, is to make sure that you limit the number of things that you're trying to do. So many times I hear people say, we're going to change the world overnight and we're going to have these 5 different tests. Well, typically just developing one is really hard. This journey with Cologuard now is going on 12 years, and we're still in the early innings from my perspective. So if you have more than 3 priorities, you actually have none.
I'm curious, given where we are right now, what are you excited about for 2021?
Well, our 3 priorities for 2021 are to get more people tested first and foremost. The second thing that we're focused on is advancing our pipeline. And that's really important because of what we're doing to improve Cologuard. And the third priority is enhancing our customer experience. So we with Cologuard, we consider people customers because they're not patients yet. And hopefully they never will be.
Kevin, I can't thank you enough for joining us on this medical moment. It has been such a joy and a pleasure, not only to have had the experience of working with you, but to interview you for this little bit of time.